Singapore is lowering the minimum age for people to be vaccinated against COVID-19. Authorities are also tweaking the vaccination strategy to allow more to receive a first dose. The changes have been announced by Singapore's multi-ministry task force and are aimed at boosting vaccination rollout. More than 1.4 million people have received both vaccine doses so far. Now, the eligible age range for the Pfizer shot will now include 12 to 15-year-olds. Previously, the vaccine was allowed for use only for people aged 16 and above. The latest data shows that the vaccine has high efficacy and is safe for the younger age group, consistent with that observed in adults. Now, at the same time, from tomorrow, Singapore residents aged 40 to 44 can register for their coronavirus shots. If supplies arrive as scheduled, the task force says that Singapore is on track to complete vaccinations by the end of the year. And to give more people protection with one dose of the vaccine, the interval between first and second doses will be extended. The current 3 to 4 weeks will be increased to 6 to 8 weeks. The change allows for an extra 400,000 people to get their first dose by July. And then by August, nearly 4.7 million people would have received it, nearly the entire adult population in Singapore. The health minister says data has shown such a move maximizes vaccine coverage without impacting immune response.
The end point is the same, which is at the end, everyone will get their 2 doses. The difference is that we are trying to, instead of having a good number of people getting maximum protection, we make sure we get the maximum number of people get good protection.
More now from CNA's Deborah Wong. Deborah, now that Singapore authorities have approved the Pfizer-BioNTech vaccine for kids 12 to 15 years old, does this mean that they'll be able to get their jab soon?
Well, they will be eligible to take the vaccine, but they are not a priority group at the moment. So the program is still being progressively rolled out to groups of 5-year age bands, and that's going to be starting from 40 to 44 tomorrow. Of course, given the large number of cases involving children in recent days, like what we've seen from the transmissions happening in the tuition centres, it might seem like the logical thing to push them forward first. But the task force will continue to monitor the situation. And as for now, they said it's not yet clear if the infections in the children will have led to more severe outcomes. And for now, what we know is that the affected children appear to be relatively well. They're either mildly symptomatic or asymptomatic. Let's hear more from the task force.
We continue to keep a close watch on them, to monitor them, and we hope they will continue to do well as they recover from these infections. But it's not clear whether or not with a higher number of children, whether or not we will see more utilization of hospital beds, more utilization of ICU beds, whether there will be more sick. And this is something we'll continue to look very closely and watch carefully.
Now, Deborah, now the time between the first and second dose will be longer. Can you elaborate more on the rationale behind this longer interval?
Well, Oteli, it's crucial to know that the primary objective of the vaccination program was really to give people the best protection possible. So when we first started targeted groups with a larger exposure risk, now we're looking at healthcare workers, frontline workers, these people were actually given priority at first. But right now, we've evolved to the next phase to get as many protected with at least 1 dose as possible. Now, this is also against the backdrop of finite vaccine supplies. And does this work? So far, the scientific evidence points to that it has. Efficacy rate is pretty good. In fact, scientific data from manufacturers have shown that a prolonged interval of up to 8 weeks has no detrimental effects. Now, the manufacturers and health regulators have an international repository of data. And of course, this will be fine-tuned as more and more people get vaccinated. So obviously, we will have fresh insights every now and then. And Singapore won't be the first to take up this approach. In fact, UK and Germany have already adopted this. Now, but regardless, the health minister, Ong Ye Kung, says that Singapore's earlier strategy to focus on more vulnerable groups was the right one. Let's hear more from him.
So now a very high percentage of them has been fully vaccinated, which I think also to some extent, helped in this current outbreak. I think without those vulnerables and those on the front line fully vaccinated, the outbreak could have been worse. So I think, on hindsight, it was still the right thing to do. But now, as we enter a new phase of vaccination, we should adapt and try to cover as many people as possible.
But, even as the vaccine program gets accelerated, the task force did caution that Singaporeans, even those vaccinated fully, shouldn't let their guard down since the virus keeps mutating. And if a viral variant that's more transmissible, higher in severity, even to the point of, risking people's deaths, the task force could introduce booster shots down the road to tackle this issue. Back to you.
Thanks very much, Deborah Wong, there reporting for us.
At the same time, authorities are recommending masks with a better capability to filter, like surgical masks, amid a recent rise in local COVID-19 cases. The guidelines, expected to be released soon, will advise the public to use a mask that has at least 95% bacterial filtration efficiency. Isabel Lim joins us for more details on this. Isabel, walk us through these proposed guidelines and how they're going to affect the masks we wear now.
Right, so like you mentioned, the guidelines, the full guidelines won't be out just yet. But today at the Ministerial Task Force press conference, it did give us, a little bit of a gist of what's to come. So the gist of it really is that they are recommending masks with a good filtration ability. And some of the examples that they listed included surgical masks, like the blue one that I'm wearing currently. But it will also include reusable masks. And some of those examples that they mentioned was reusable masks that have been distributed nationwide, like those from Temasek or the People's Association. They made sure to mention that for those particular masks, it's best to keep to the stipulated use time. So, for instance, if those masks are recommended use for 30 times only, you shouldn't be, washing and reusing them repeatedly. Now, for other kinds of reusable masks, like cloth masks that may be homemade or, even bought at some of these smaller shops, like, at the ones at the town center that I'm currently at, they recommend that for these particular masks, they need to be, at least double layer and ideally worn with a mask filter in between. Now, during the press conference, of course, reporters, we also asked them whether there would be any supply side issues. If you can recall, last year, very early on in the pandemic, there were long lines forming for surgical masks at pharmacies across the nation, really. And, some of the shops and even online, they were selling out. But the task force, tried to, they really assured us and they said that the situation now is very different from last year. Shops are well stocked. There is a national stockpile of surgical masks. And now we actually also manufacture them locally as well.
Isabel, what's the thinking or the rationale behind these proposed guidelines?
Right. So the task force also mentioned that, new information was coming out from international health authorities, including the World Health Organization, that COVID-19, confirming that COVID-19 could now be transmitted via air, so via aerosolized particles or airborne particles. So part of the reasoning for changing the mask guidelines, rests on that kind of new information coming up. But they also said that, the review of the mask guidelines is part of a multi-pronged strategy that is reacting to the local COVID-19 situation now, with a rise in local community cases, as well as what seems to be a more transmissible variant going around.
Given that the public have been having to deal with COVID-19 for the better part of 15, 16 months, there will come a time when we start getting fatigued, complacent, and we may not be necessarily as rigorous and disciplined in the protective measures we adopt for ourselves. It actually is timely for us also to relook at the mask advisories we give, and we want to affirm and emphasize that it is important to use good quality masks. Good quality masks worn well and properly provide an excellent form of protection for all of us.
I think it's important that everyone wear a proper mask in ways, not so-called homemade or whatever things, because they don't know what is the condition, what is the requirement of a mask.
It's better to go for safety rather than fashion. So I think the implementation is good. So it's more safer for the people. And at the same time, maybe hopefully it also brings down the number of virus infections.
With the old mask, we think that it's nothing. We just wash and wear, wash and wear. And you've forgotten that when you wash, the thing becomes thinner, there's no protection.
Thanks, Isabel. Isabel Lim with the latest on Singapore's mask recommendations.